I agree. And even though we're a much smaller system, we're all over the country, but we face the same difficulties financially that the bigger hospital system faced, unfortunately. But one of the things that we're implementing for our hospital is that we're actually basically putting what's called the population health IPA, value-based medicine, around each of the hospital, which is pretty innovative. No one else in the country is doing that. So imagine like a Kaiser, except much smaller, much more localized, and you could replicate it around the country. And so the idea is that, I think everybody knows what an IPA or population health is. It's just basically a collection of doctors, right? And so what you do is, you around each of our hospital, we have that group of doctors around our hospital. That group of doctors then, if they have a sick patient, they would send that patient to their own hospital, right? Because all these population health companies out there, Walmart, Walgreens, even I think Costco is getting into the game. What they have in common is that none of them have their own hospital. And hospital care is the most expensive care, unfortunately. And so if you could use the micro hospital to control that cost with the population health, then it's win-win. It's actually a win-win-win. It's a win for the IPA because when they refer the patient to your own hospital, the cost is a lot less because we're not gonna charge ourselves more than other people charge us, right? For the hospital, it's a win-win because they get more volume from the referral from the primary care. And then the patient wins because it's a coordinated care, right? Because Dr. A talks with Dr. B. They work together day by day. Whereas right now, if you go to, what have you, Walmart clinic, CVS clinic, and you have to go to the hospital after that, those doctors don't talk with each other. The doctor doesn't know what's going on in the ER, and because the doctor over here at the Walmart never calls them to tell them the patient's coming. And so the patient care gets disrupted. And so I think that's probably one of the biggest issue in healthcare right now is that there's no communication between systems. So if you could sort of like streamline that and make it so that everybody communicates, I think it's just a win-win-win for everybody.
Yeah,